Well, I certainly never expected when I was in high school and college and even in medical school that the main focus of my career would be male cosmetic surgery. I never imagined that. I sort of happened into it by circumstance, in that I am a board certified urologist, and I have done extensive training in plastics and reconstructive urology. I am an active member of the Genitourinary Reconstructive Surgical Society. I present many papers at their meetings. And because of my status in the field of reconstructive urology, all of these disaster patients that had gone to Mexico or had gone to some Central American country or had gone to someone here in the United States and it had some cockamamie procedure performed that left them or left their penis deformed, and I mean really deformed to where it did not even look like a penis. By happen chance, they were coming to me to see what I could do to restore the normal anatomy of their penis. It's very hard after a botched surgery, and some of these men had had many attempts at a botched surgery. They'd had more than one botched surgery. So it's very difficult for me to get these men back to where they wanted to be. So out of, not intentionally, but more unintentionally, I sort of migrated over and said, someone needs to be doing these procedures that can do them correctly from the beginning. And that would make my life a lot easier and a lot more pleasant if I didn't have to deal with all these botched surgeries, if I just did it from the beginning and I did it right. And I did it with standard medical procedures. Everything we do here at Rejuvall is a standard accepted medical procedure that is being done 1,000 times at plastic surgery centers all across the United States. Every plastic surgery center is doing Mons plasties. Every plastic surgery center is doing abdominoplasties. Every plastic surgery center is doing fat grafting. So what we do is standard medical procedures. What most people don't understand, surgical procedures are not approved by the FDA or the Food and Drug Administration. The FDA or Food and Drug Administration, they approve drugs and devices. So they approve the filler substances that we use. So if we're going to use an injection of a foreign substance, everything we use is approved by the Food and Drug Administration. So everything we do here is standard medical therapy that's done in thousands of plastic surgery centers across the nation, only using surgical techniques that are common and only using products that are approved by the Food and Drug Administration. I appreciate the fact that you're doing research on the internet, but I hope you know most of the information you're getting on the internet is inaccurate, and not just a little inaccurate, it's extremely inaccurate. But there's so much misinformation out there about the suspensory ligament. Releasing the suspensory ligament does not add any length to your penis. Simply releasing the ligament does not add any length to your penis. Also, the fact the suspensory ligament is not a rubber band-like structure that you see drawn in anatomy books. The suspensory ligament is a very complex anatomic structure that is highly variable. It can be short and wide and thick. It can be long and narrow. They can be one suspensory ligament. They can be four suspensory ligaments. So it's a highly variable anatomic structure, we are all different. There's not another human being on this planet that has the same anatomy that you have. We're all different. And there's not one surgical procedure that can be applied to every man walking and alive that will give them a good result. So if you're interested in a place that does the same procedure for every man, I would not walk away from that place. I would run as fast as you can away from that place, because we are all different humans. And I pride myself that here at Rejuvall, with Dr. Morgenstern and myself, we individualize treatment based upon the anatomy of the patient. So the procedure I do on you, the procedure I do on your golfing buddy, the procedure I do on your neighbor, the procedure I do on your brother-in-law may all be different procedures, but they will all be the procedure that you need for your body type and for your particular anatomy and for your vision of what you want to look like after the procedure. So the fact there's so many of these places that simply think they can inject every penis with the same substance and give everybody the penis that they want, that is just wrong. So I may have 4 different answers for you, your golfing buddy, your neighbor, and your brother-in-law, but that's because you're 4 different people and you need 4 different answers. So by happen chance, because Dr. Morgenstern had actually laid the foundation for a lot of what we do here at Rejuvall, by happen chance, Dr. Morgenstern and I had the same vision that we want to help these men and we want to do it right from the beginning rather than deal with complications of other surgeries. And since mine and Dr. Morgenstern's vision was very similar, I came here to Rejuvall so that we could help these men out the gate from the beginning without taking care of someone else's complications. My heart goes out to these men. None of our patients decide on a Saturday that they want to have cosmetic surgery and come to see us on Monday. These men have agonized. They have lost sleep. They have saved money. They have worked overtime. They have spent countless hours on the internet researching this topic. So I want the men to know that they're not alone. There's hundreds of thousands of men out there doing the exact same thing they're doing at the exact same time. I guarantee you, while one man is sitting there on his computer in the state of Georgia researching this topic, there's another man in the state of Wyoming. There's another man in the state of California. There's another man in the state of Nevada. There's another man in the state of Arizona doing the same thing late at night on their computer researching the topic of male enhancement surgery. So I want them to know they're not alone. And we see thousands of these men a year. They all tell the same story of the dedication and devotion over the years that they have had to seeking a solution that will make them feel better about themselves. So, number one, you're not alone.